the Caribbean region has the highest incidence rate of HIV in the Americas. And when we look at the world, we have the second highest prevalence rate of HIV AIDS in the world, only second to Africa. So right away, you see that it's a huge problem that we still need to fight. And there are a lot of challenges here, because when we look at our target population, who are key population, so when we're talking about men who have sex with men, female sex workers, transgender persons, these are groups that are marginalized in the Caribbean, right? So we're really having struggles with human rights issues, which in turn help to propagate, the HIV epidemic. So the main objective of the project is really to work with our member states to improve the capacity of both their health and community systems to actively and sustainably reduce the incidence of HIV infections, especially among the key populations that we mentioned, but also to reduce the incidence of other sexually transmitted infections and to eliminate TB. And when we say eliminate TB, it's really reducing it to where it's not of public health significance for the region. So what this project has done, what the Commission as the principal recipient of this project is doing, is really trying to work with communities to remove some of the human rights challenges, to remove some of the gender-based challenges that tend to, propagate the spread of HIV. And so our community partner is actively working with community members. So these are people infected with HIV and also affected by HIV. So going in, working with sex workers, empowering them, telling them about their rights, working with men who have sex with men, telling them, about the new interventions which are out there like pre-exposure prophylaxis, ensuring that they can access these things. So we procure a wide range of health commodities. We procure condoms, we procure HIV testing supplies, and these are free to persons in the participating countries. Our lab partner really works with both the health system as well as the community partners to strengthen HIV testing, to strengthen testing for things like syphilis and hepatitis, which are all related to the whole HIV epidemic. So really we want to ensure that persons can access prevention and treatment where they need it. And we're working with the ministries, and this is not only the ministries of health, but also working with some of the social, that the ministries are responsible for social security and all these things, to ensure that these marginalized populations, they, in a way, no longer remain marginalized. Stigma and discrimination, unfortunately, still exists, and a lot of this is affecting the ability of these persons to access prevention and care. And that's why the focus of the project is on this population. Maybe 10 years ago, persons were using a lot of pills. You had to use maybe 3-4 pills to actively, control your HIV. Now, the grant is procuring what we call a dolutegravir-based regimen. This is a medication that is supported and recommended by the World Health Organization. It's one small pill, and it has greatly improved the ability for persons with HIV to adhere to their medication. So you're just taking one pill a day and you can really control your HIV. Once your HIV is controlled, or what we call viral suppression, then you're no longer able to transmit HIV sexually, right? So this means that women can have, if you're an HIV positive woman, you have a partner who's negative, you can have a child with that partner, So really trying to empower people and educate persons on the developments that have been realized within the HIV and AIDS space. So yeah, this project has done a lot and will continue to do a lot for that population. So to anyone out there who has who is at risk of contracting HIV or who already has HIV, this is really something that the Commission is doing in partnership with the Global Fund to ensure that you are taken care of. So the primary beneficiaries are the independent member states, so Antigua and Barbuda, Grenada, Dominica, St. Kitts and Nevis, St. Lucia, and St. Vincent and the Grenadines. However, when we have training activities, especially if they're virtual, we also bring in the other associate member states. So those are the overseas territories that are part of associate members of the OECS. We've really been able to improve the laboratory capacity of the countries to both diagnose and to monitor persons who are affected by HIV. So we've done a series of trainings to improve human resource capacity. We've done a series of procurement in terms of health commodities and health equipment. So for example, CD4 testing, they each now have platforms of their own to do CD4 testing. We provide commodities for viral load testing. And then we're also looking to strengthen the regulations of laboratory in the region so that there's some sort of standardization across member states. So the HTEP project has been around since 2005. So next year, actually, we're going to be completing 20 years of implementation. And coincidentally, that will be, the commission will be wrapping up as the principal recipient. So in terms of next steps, we're really looking to implement 2 key activities. So one, it's pre-exposure prophylaxis, or PrEP, and that is really the use of antiretroviral medication by persons who are HIV negative to actually prevent them from contracting HIV or to reduce their chances of contracting HIV. It's something that has been around for quite a while, but in the Caribbean as a whole and in the OECS, it has taken a while to catch on. So we've actually just recently completed some training. We've sent the commodities to the countries to be able to implement this. So it's really now just for them to take the next step in terms of actually doing a bit of more public awareness and to actually roll out pre-exposure prophylaxis. At the member states level, we work with primarily the ministries of health. So each ministry of health has a national AIDS program coordinator or a national AIDS program manager. So that's our main focal points. We're also intimately involved with a community organization known as the Regional Coordinating Mechanism. They actually have oversight of the project, and they're the ones who are responsible for creating the proposal and all these things. So they are the ones who actually follow up with us to ensure that the project is being properly implemented. And then we work with other partners, other regional partners. So we have the Caribbean Med Labs Foundation. They're our laboratory partner who provide all of the capacity building that I would have mentioned before. And we have our community support partner, which is the Caribbean Vulnerable Communities Coalition. They're based out of Jamaica, but they do a lot of work in the Caribbean and also with us here, strengthening the community response to HIV. So we receive funding from the Global Fund to Fight TB, HIV, and Malaria, and they are based in Geneva, Switzerland. So we provide, we report to them on an annual basis in terms of where we are with both programmatic and financial implementation. And as I mentioned before, the RCM, or the Regional Coordinating Mechanism, also plays a vital role in this whole setup where they kind of oversee with us. They also report back to the Global Fund in terms of how we're doing with our implementation, what we need to tweak, and all these things. We're also thankful for our technical partners, specifically PAHO and UNAIDS, who provide a lot of the technical assistance to really help with the capacity building and some of these other areas that we need the support.